Most of you are probably familiar with the term postpartum depression, and some of you might not have any idea what I'm talking about. The fact of the matter is, 1 in 7 women are affected by postpartum depression after giving birth, as stated by medicalnewstoday.com. Also stated by medicalnewstoday.com, postpartum depression can remain a long-term problem for some women, especially if they don't receive treatment. Recently, the FDA approved the first real treatment for postpartum depression. Until now, women relied on symptom management, but this treatment can be life-changing for women. Treating postpartum depression in women would allow new mothers to better care for their newborns and lower their risk of suicide. First, I'll explain exactly what postpartum depression is, then I'll talk about how exactly it affects women, and last I'll talk about the treatment that was recently approved. So, what is postpartum depression? Postpartum depression is the severe, long-lasting form of depression that affects new moms shortly after giving birth. According to the Mayo Clinic, symptoms usually develop within the first few weeks after giving birth, but may begin earlier, like during pregnancy or later, up to a year after giving birth. Postpartum depression symptoms include depressed mood, excessive crying, difficulty bonding with the baby, withdrawing from the family, thoughts of harming yourself or the baby, and so much more, like hopelessness, irritability, etc. These are all major depression symptoms that are often overlooked in new mothers and chalked up to them being stressed about the new baby. Postpartum depression has always and will always affect new mothers. Sometimes postpartum depression is confused with something called baby blues, which is also a postpartum mood disorder. According to postpartumdepression.org, postpartum blues is a mild and short-term mood disorder that results after pregnancy. It's one of the more common types of postpartum depression, sometimes termed the baby blues. This condition is something that many new mothers experience. Baby blues and postpartum depression are very different, since the blues aren't considered serious or severe and are a direct result in the changing hormone levels in a woman. They're normal, and baby blues are way more common, affecting 70 to 80% of women. They're a normal part of the postpartum experience. Sometimes, but very rarely, new moms experience another postpartum mood disorder called postpartum psychosis. According to the clevelandclinic.org, postpartum psychosis is a mental health emergency. This condition affects a person's sense of reality. It causes hallucinations, delusions, paranoia, and other behavioral changes. Postpartum psychosis is extremely dangerous, as it can appear out of nowhere in mothers with no history of depression or psychosis, though it's much more common to appear in women with a history of these mental disorders. In the United States alone, postpartum psychosis affects about 1 in every 1,000 births each year, and it's more common under postpartum psychosis for women to want to harm their babies after giving birth, which is why it's such an emergency and so dangerous. Postpartum depression is a type of depression that has other disorders that stem from it, like the baby blues and postpartum psychosis. Now that we know what postpartum depression is, we can talk about how it affects women and how dangerous it can actually be. Postpartum depression is a major cause of suicide in new mothers, and in extreme cases, it can cause mothers to harm their children. According to InStyle.com, a study which looked at about 1 million women who gave birth in California from 2010 to 2012 found that of 300 women who died during a 1-year follow-up period, suicide was the 7th leading cause of death, which was about 15 deaths. I know this statistic doesn't seem very high, but it's still way higher than what's expected. Suicide in new mothers may be more than what's actually reported, since the term maternal mortality only applies to women who die while pregnant or 42 days after the termination of their baby, and a pregnancy-related death only lasts until 1 year after the child is born. This definition doesn't include accidental or incidental deaths, meaning suicide is left out. There is a major lack of research in this field. As long as there's a lack of research, then more and more new mothers will be affected. In postpartum depression, along with harmful thoughts aimed toward oneself, sometimes comes harmful thoughts toward your newborn child. Many hear stories in the news about a mother killing her own babies, and we are filled with disgust, which we should be, but many don't understand that this is a way more extreme symptom that comes with postpartum depression and postpartum psychosis. Mothers who experience any postpartum disorder and don't seek any form of help or treatment are the ones most at risk. The mania and depression that can come from these disorders are way too overlooked, and they have to be addressed to keep our mothers and our newborns safe. So the most dangerous outcome from postpartum depression is suicide post having a baby in mothers, and infanticide, which is a mother killing their baby. We know what postpartum depression is and how dangerous it can be, but how can we treat it? Recently, in 2019, the FDA approved the first real treatment for postpartum depression. Though there have been other symptom-reducing treatments available in the past years, this one is the first one that's specifically for postpartum depression. The drug is called Zulresso. It's an IV injection, which Tiffany Farchione of the FDA states, this approval marks the first time a drug has been specifically approved to treat postpartum depression, providing an important new treatment option. Zulresso is an antidepressant that requires a prescription, and it's only given under supervision of a doctor. This drug has some major risks, including sudden loss of consciousness and excessive sedation. As of now, Zulresso is only given through a restricted program called the Zulresso REMS program that requires a healthcare provider to administer the drug in a healthcare facility. And though it has its risk, Zulresso has been proven effective. There were 2 clinical studies done, with one group having severe postpartum depression and the other having moderate postpartum depression. Zulresso was superior in the treatment of postpartum depression to the placebo given in both of the studies. At the end of the infusion, patients experienced improvement in depressive symptoms, as well as improvement after 30 days. This drug is a game changer for new mothers as well as newborns. Zulresso can and will save lives. It will reduce suicide rates as well as infanticide rates. This was only the first treatment approved, and I expect more in the near future. So first, we went over what postpartum depression was. We covered the symptoms and the different types, and second, we talked about how dangerous it could actually be. And finally, we talked about Zulresso, the new FDA-approved treatment specifically for postpartum depression. This new treatment for postpartum depression will save the lives of mothers and newborns. Suicide rates in new mothers will go down, as well as rates of postpartum psychosis. This treatment is available for new mothers and will probably continue to be improved and made better for future generations. If you had no clue what postpartum depression was before my speech, then you do now, and you're at least a little bit more prepared for the future. I hope that more studies and more treatments are approved regarding postpartum disorders in the future, but as of now, I'm surely glad we're getting started.